Real-life consultation can be complex and challenging. Sometimes, doctors can be thrown off by a curveball in the consultation. The other day I was talking with a GP registrar who struggled with the RCA. He was not confident in driving the consultation forward and often got flustered. We identified a major weakness in his consultation, and that was he didn't have a good structure. If a doctor doesn't have some sort of structure of the interaction, the consultation can get out of hand easily. How can you consult more effectively? This is where a consultation model can help. Using a framework to ensure a fluent and systematic approach will ensure a consultation does not appear disjointed or unstructured. Understanding your consultation is important to be able to improve it. If you want to learn how to improve your consultation skills, this is a video you don't want to miss. We're going to explore 3 consultation models that will hopefully help you. If you're new to this channel, hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a happy and fulfilled life. I publish a new video every Thursday on the subject of happiness and well-being. If you're not already subscribed to this channel, make sure you're subscribed and turn on notification so that you're notified each time I publish a new video. The various consultation models out there, we will focus on Pendleton, Neighbour, and Calgary Cambridge. Pendleton was one of the first patient-centered models that encourages the doctor to involve the patient in the management plan. Pendleton model describes 7 tasks that need to be completed in the consultation. The first task is to define the reason for the patient's attendance. In real life, you might encounter a patient who presents with a history of a presenting complaint. It could be chest pain, shortness of breath, or cough. There's usually a trigger why the patient decided to present now. It could be a patient has a relative who was just diagnosed of a cancer, or they've read something on the newspaper, or it could be their relatives who are worried about their weight loss, so ask them to see the doctor. It's important to establish the reason of the encounter and why the patient is presenting now. The second task is to consider other problems. In real life, patients often present with more than one problem, so it's important to explore whether a patient may have multiple problems in a consultation. By screening for other problems in the beginning, you would be in a better position to deal with these problems and prioritize which problem to address today. Number 3 is to choose an appropriate action for each problem with the patient. You might be able to negotiate with your patient which problem that could be addressed today, and if there's not enough time to address it, what course of action would you recommend? Number 4 is to achieve a shared understanding of the problems with the patient. Shared understanding is an integral part of patient-centered care. It's vital to understand the patient's agenda and take it into consideration in decision-making. Involving patient in the management ensures shared decision-making. This is where listening skill is important. You need to be listening to your patient and understand where they're coming from, get their perspective on the problem so that you'll be able to help them. People have a need to feel understood. When you demonstrate that you have understood a person, they're more likely to be open to your recommendation. Number 5 is to involve the patient in the management and to encourage the patient to accept appropriate responsibility. Involving the patient in the management decision is important because we want to provide a patient-centered care. The more invested a patient is in their care, the more likely that they will follow through. The idea of encouraging a patient to accept appropriate responsibility is to help them to self-manage. Encouraging patients to accept appropriate responsibility is a crucial component of Pendleton's model. The aim is to empower a patient to be in control of their health. If you want to learn more about shared decision, watch a tutorial I made in which I go in more details. You will find a link in the description below. Number 6 is to use time and resources appropriately. In the healthcare system, we have finite time and resources. It's important to distinguish between a patient's needs and a patient's want. Sometimes patients may request investigation that might not be appropriate, and it's important to explain why you don't think an investigation is needed and offer an alternative reasonable option to the patient. Last but not least is to establish or maintain a relationship with the patient, which helps to achieve other tasks. Building rapport and maintaining a good patient-doctor relationship will help the outcome of the consultation. So it's important to keep this human element of the interaction. This is usually achieved by demonstrating good interpersonal skills, such as listening to your patient, acknowledge a patient's concern, addressing a patient's concern, and showing empathy. Neighbour is one of the most well-known consultation models. It is a 5-stage model that is easy to remember and follow the natural flow of the consultation. The 5 stages described by Neighbour include connecting, summarizing, handing over, safety netting, and housekeeping. Neighbour was the first to introduce a safety netting idea. He recognized that things may not go to plan and patient may need to be reconsulted. Advising patient when to seek medical attention is a core component of GP consultation. If you want to learn more about safety netting, watch my tutorial, which people have found very useful. You will find a link in the description below. The 5th and final stage introduces the idea of housekeeping. Neighbour was the first who introduced this step. Imagine if you've had a challenging consultation. Perhaps you broke bad news to a patient with a young family and your emotions are running strong. Housekeeping prompts doctors to acknowledge and deal with personal emotions arising from the consultation before seeing the next patient. This prevents projecting strong feelings and emotions on the next consultation. Some doctors might take a quick coffee break or have a chat with a colleague to manage their strong emotions. How do you deal with emotions arising from consultation? I'm curious to read your comments on how you deal with strong emotions arising from consultation. Let me know down in the comment section. The 3rd model is Calgary Cambridge. This is a 5-stage model that promotes a very patient-centered approach based on collaborative partnership. It incorporates the physical, psychological, and social aspects of the consultation. The first step is to initiate the session. The second step is to gather information. The third step is physical examination. The 4th step is explanation and planning. Last but not least is the 5th step, which is closing the session. There are also 2 threads that run throughout the consultation in parallel to the 5 stages. These are called building the relationship and providing structure. Calgary Cambridge considers the psychosocial component of the patient's life and integrates it into the management. Each consultation model has its advantages and disadvantages. No consultation model is perfect, but using an appropriate consultation model can help you to structure a fluent conversation that progresses logically while maintaining a patient-centered approach. You can try a model or 2 and adapt components of each of them that work for you and develop your own consultation style. Thank you for making it to the end of this video. If you found this video useful, make sure you drop a like. This is a free way for you to support this channel and help me to know whether you enjoyed this video. If you haven't already subscribed to this channel, make sure you subscribe and turn on notifications so that you're notified each time I publish a new video. If you want to improve your skills at shared decision making, make sure you watch the next video. Take care everybody. Bye bye.